Listen to the following talk.
Psychiatrist Therapy. Sometimes it's hard to distinguish between a patient and a psychiatrist. My teacher, who was a lecturer at Hanoi Medical University, joked while teaching psychopathology. His point was that after working with psychiatric patients for a long time, the way psychiatrists communicate, talk, and even gesture starts to resemble that of the patients. This involves slow speech, simple, brief words, sometimes repetitive, and always accompanied by the question, "Do you understand?" The doctor has to do this to ensure that the patient comprehends and follows instructions, and it also serves as a way to assess the patient's level of alertness, clarity, and verbal communication ability. After finishing the lecture, the teacher asked, "Do you understand?" We all burst out laughing, saying, "This is a perfect example of an occupational hazard." Occupational hazards are not unfamiliar, especially in certain professions. For instance, people working in mines are at risk of lung diseases, and sanitation workers are prone to skin conditions. However, few people consider the occupational hazards faced by psychologists or psychiatrists. According to Circular Number 15/2016 of the Ministry of Health, there are 34 occupational diseases covered by social insurance, categorized into 5 groups. I didn't see any diseases related to psychology or mental health. Those working in psychological counseling or psychiatric treatment are often assumed to always remain lucid, coherent, and composed, capable of handling any situation. So, when my friend, who works as a school counselor for an international school in Hanoi, shared on social media his desire to find a counselor for himself, he received hardly any helpful information, aside from a bunch of ha-ha emojis and comments praising his good sense of humor. Psychologists and psychiatrists are not immune to mental health issues like sadness, anxiety, stress, or depression. Like any other profession, they too face worries and pressures related to their work. I still remember the case review sessions of an online youth counseling project I was part of many years ago. These were weekly, sometimes even daily, meetings to evaluate the performance of each counselor, aiming to improve service quality. Many of these meetings ended with tears from those receiving feedback. They could easily be hurt by overwhelming demands or out-of-bounds remarks, whether intentional or not. Psychologists and psychiatrists need support in many issues related to professional ethics, which are often not easily defined in black and white. They may find themselves in ethically ambiguous situations due to the compromised clarity and coherence of their mentally ill patients. Ethics encompass many aspects, but the most crucial one is to avoid exploiting the vulnerable, dependent state of patients for personal gain or harm. For example, a psychologist might intentionally prolong therapy sessions to earn more fees, or engage in romantic or sexual relationships with a patient during counseling. On a less negative note, the inability to help clients resolve their problems can also lead to stress for therapists, especially when dealing with clients who have suicidal thoughts or harmful intentions toward others. Prolonged exposure to clients' issues, particularly highly sensitive, private, or even shocking ones, can lead to emotional trauma for the psychologist. A recent report from the Ministry of Health stated that around 15 million people in Vietnam suffer from mental health disorders of varying severity, with depression and anxiety being the most common. Meanwhile, the mental health care network in Vietnam remains inadequate in both quantity and quality. The country currently has 605 psychiatrists, averaging 0.62 per 100,000 people, compared to the global average of 1.7 and 8.6 in high-income countries. People with mental illnesses are often stigmatized and shunned, so they tend to hide their conditions and feel ashamed if others find out. For psychiatrists and psychologists, professional pride and the pressure from social stigma may lead them to hide their own mental health issues even more carefully. And like any illness, the longer it is left untreated, the harder it is to cure. Not everyone is as courageous as my friend, who acknowledged his issues and openly sought help. This year's World Mental Health Day theme, prioritizing mental health in the workplace, is a reminder that some of this priority should be given to those providing psychological counseling and therapy, so they have the opportunity to address their own issues, because, like doctors, they cannot heal themselves. This is also an opportunity to improve the quality of the currently weak and insufficient mental health professionals and counseling experts.
This content is just an example for learning English. Thank you for watching. How do you feel about this video? Please leave a comment below.